Right now, over 80 million Americans, about 1 in 4 people, rely on Medicaid for healthcare. It's the single largest health insurance program in the US, bigger than Medicare or any private insurer. But what would happen if, overnight, Medicaid disappeared? Medicaid is a federal state program designed to provide health coverage for low-income individuals, pregnant women, children, people with disabilities, and seniors needing long-term care. It's not just a program for the poor. Medicaid covers 42% of all U.S. births, 60% of nursing home residents, millions of children and adults with disabilities. States administer Medicaid with federal matching funds. It's complex, but for tens of millions of people, it's the only reason they can see a doctor, afford medications, or live in a nursing facility. If Medicaid disappeared, the effects would be immediate and catastrophic. First, over 80 million people would instantly lose health coverage. Children would miss vaccines and basic care. Pregnant women would lose prenatal services. Elderly nursing home residents could be displaced because facilities couldn't afford to keep them. And hospitals, especially rural hospitals, that rely heavily on Medicaid reimbursements, would be devastated. Some would close entirely. Others would cut critical services like maternity wards, pediatric units, or trauma centers. And for families, medical bankruptcies, already a leading cause of personal bankruptcy in the U.S., would skyrocket even higher. But the impact wouldn't stop with Medicaid recipients. Medicaid is the backbone of many state economies. In some states, Medicaid makes up over half of the total healthcare market. If Medicaid funding disappeared, hospitals would shift the cost onto private insurance payers. Insurance premiums would rise for everyone, not just low-income families. State budgets would collapse under the burden of trying to replace billions in healthcare spending. Emergency rooms would overflow with uninsured patients seeking care they can't afford anywhere else. Whether you're on Medicaid or not, you're connected to it. Your community hospital relies on it. Your insurance premiums are lower because of it. Your neighbors and family members may depend on it without you even realizing. Medicaid isn't just a program for some Americans. It's a pillar that holds up the entire U.S. healthcare system. If it disappeared, the shockwaves would touch every life, not just the lives of those enrolled. Medicaid matters more than you might think. Subscribe to Healthcare Digest to keep learning about how our healthcare system really works and why it needs to work better for everyone.